Today marks 400 days since our first outbreak of COVID-19. Week 58, believe it or not, it's been a long time. So thank God there's no one we're reporting that passed away last night, but we still stand at 369 people that passed away since this outbreak has started. So again, my condolences and prayers go to the family. As of yesterday, some of the good news, we're going in the right direction. 47.3% of Albany County residents have received at least one dose, and an estimated 33.3% have received their second dose, meaning they're completely vaccinated. Compare that to the statewide rate of doses administered, it's 39.6%, and full vaccinated rates 26.4%. To date, Albany County has administered 51,046 first and second doses of COVID-19. We have administered alone through the health department, through Dr. Whelan's leadership and her team there, 34,479 doses at our clinics at the Times Union and Cap Center. With the vaccine being reallocated, there's been vaccine pods at the University of Albany, College of St. Rose. I got to walk around with Chancellor Jim Malatras yesterday to see the good work that's going on up there and how we're keeping the school going, administrators going, and obviously getting kids back in the classroom. St. Rose, the acting president, Marcia White, had a great time walking around with her, meeting the students. Again, in a partnership, you can get through anything, and to working together and being creative and finding new ways of doing things is how we've been operating for the last 58 days, 400 days, right? And, it's been crazy. But we did 490 U-Albany and Russell Sage facility staff were able to get their second dose. And at the Times Union Center on Wednesday, there was 881 shots given out. So again, thank you to everyone doing what they're doing. And we got to walk around with the second dose clinic yesterday with the Leah group, who helped us out. Bill Leah, it was nice. He came down with his team. They donated 2,000 pairs of gloves and disinfection wipes in sharps containers. And I do want to say thank you and to all the businesses in Albany County that have really stepped up to help one another. Thank you so much, because again, every little donation makes a big difference. To Bill Lee and the Leah group, again, it was nice for them to come down in person to do that, to walk around with all of them, and really got to see the pod, and they were so impressed. They were just like, they couldn't believe it, and to see what their donations being used for really meant a lot to the Leah group and to everyone involved. So to Dr. Whelan again and the Leah group, thank you so much. It's so important that we make sure that health workers continue to wear PPE, have the proper PPE to continue to do this, to the medical corps, to the volunteers, to the workers that are on the front lines every day doing this. We want to make sure that your health and safety is first and foremost, and by people doing this, we'll continue to go in that right direction. So thank you to everyone. We're continuing to make residents to get vaccinated. Some of the issues we had with the J&J, that it was pulled off. So there was some hesitation. Dr. Whelan and a lot of people have been advocating, and we've been advocating here every day. Vaccinate, don't hesitate. It was hard. In the beginning, we had the demand, we just didn't have the supply. And now we're starting to have the supply. It's the demand, and the J&J didn't help. As more pods go out, as President Biden continues to roll throughout this country and through the state of New York, more and more vaccines, we need people to step up. So the people who want to get the shots, have gotten the shots, or getting the shots, there's going to come a point in time where Dr. Whelan and I are going to sit here begging for people to come out and to get the vaccine. So please, come out, be part of the solution, not part of the problem. Help us move forward in the right direction. We're almost there at the end of the tunnel. We need to get over that 70% of residents in Albany County being fully vaccinated. We can get there. I was hoping by the end of April, but now I'm starting to see that slow down. And again, and Dr. Whelan can talk about this, the J&J, over 6.8 million people have gotten that shot, 6 reactions. I'm not saying that's normal, but it happens. It's a proven product. We have to continue to move forward, so please. And I know there's people that want the one shot because it's over in 10 days versus the other 2, but take what's ever available. And again, we'll get through this by working together. Some of the other things I want to remind is that we also know that Pfizer put out that it will be putting out a third dose. You have to get a booster shot like you do the flu shot. But one of the things that we need to do is talk to the governor. I'm going to talk to General Murphy in the control room. We need to open this up to doctors' offices. We have to get that. There's a hard process to have to go out and vaccinate, and you have to go through a lot of steps to get approval from the state to give out vaccines and shots and stuff like that. And Dr. Whelan can talk about it. But we need to change that because people feel comfortable. And one thing we've learned, which is hard, and it's one of the things Dr. Whelan and her team and my office going back and forth with, are the smaller pods. It's a lot of logistics. It's a lot of more on the workers because you got to set up and break down. But people feel more comfortable going to little pods at their churches, the library, versus bigger ones. Some people don't mind the bigger ones, but then again, when you haven't been out in a while and a lot of people are staying at home, when you get in and it feels like a big crowd, but Dr. Wheeler and the team do a good job socially distancing, people feel a little anxiety. It works, the smaller pods. And some people want to just go to their own physician care doctor and get a shot from them, whoever their doctor may be, because they trust them more. So I'm going to say to the state health department and everyone else, please change it. So make it easier for doctors so they can give shots at their offices versus this, because obviously if you need a third shot down the road, Dr. Whalen and her team, I can say, all of us been going 7 days a week for 400 days. It's not going to be easy to keep up at that pace if you have to continue to do this for another year out or 6 months from now. So please, Governor, look at that and look at changing all that stuff so it's made easier to get the shots going into the future. So as of today, there's 23,233 cases of COVID-19 to date in Albany County. 68 positive cases yesterday. If you look at 3 days ago, it was 41, 63, 68. Still got to watch it. We kind of go up and down a little bit. The 5-day average was 52.6, and yesterday it was 52, so went up a little bit there. But we have 482 active cases as of today, which is good. That currently 907 people under mandatory quarantine. Yesterday was 905, and that's the lowest we've been since October 14th. So, which is good. There's some good stuff and bad stuff because we don't like to see that number go up. We still encourage people to get tested. Please, I think someone in the media or a radio show person said we need people to go out and get tested because it keeps that positivity number down or in check. And if people are feeling like, I don't need to get tested anymore, or if you have a sign and symptom, please go out and get tested and do your part. Out of the 68 new cases, 21 had close contact to a positive case. One was a healthcare worker. One reported travel out of state, and 45 had 45 don't have a clear source of infection at this time. As of today, 22,741 people have tested positive for the virus and have recovered, which is good. 53 recoveries since yesterday, which is also good. Unfortunately, we have 3 new hospitalizations overnight, brings our total up to 29 people in the hospital, and then yesterday that number was 30, so we went up a little bit, one up there. 6 patients are currently in the ICU, and that was the same from the day before, 6. Albany County 7-day average for percent positive rate is now 2.4. It was 2.6 at my last briefing on Monday, so again, that's going down a little bit, and that's what we like. We like to go down. The Capital Region 7-day average is 2.2. So, again, we still got to watch the numbers to make sure we're doing the right thing. We're almost there. The light's at the end of the tunnel. Don't let your guard down. Please wear your mask. Cough into your arm. Clean your hands. Stay 6 feet apart. We're getting through this, but you got to stay vigilant. We got to stay on top of this. The only thing I took out of today's snow, besides wanting to cry when I looked out my window thinking, I'm like, oh, God, it's snowing out, was that at least it does keep people from congregating, getting together. Nice weather, unfortunately, lets your guard down. More people get outside. It just helps us get out of this a little bit more. I guess, again, taking a positive out of a negative when I seen the snow, it's not like what we want to see in April. But again, COVID's still a threat out there, so please remember it's not going away. It's not done with us. Fortunately, we've been lucky. Dr. Whalen and I have talked about this. We've been so lucky compared to other states around this, our country that have seen other waves come in, have raised other issues. But you also got to look at how they're following the science and how they're, mask and all that other stuff and social distancing. So we are getting there. It is working. Let's get through it. Let's continue to work together. If you want to see if you're eligible, again, please, everyone's pretty much eligible. 16 and under is not so far. So 16 and up, you're eligible, but you can still call the state hotline. But go to our albanycounty.com site and please pre-register. We have gone through that list. It's been a lifesaver. You can get on the standby list too, because unfortunately people now have multiple appointments, or they get the closest one they can and they don't show up. It's working for us. It helps with the logistics behind it. It helps us fill pods quicker. And again, it's not perfect. No system's perfect, but it's working. Help us pre-register. The school district's going good. We're going to be rolling that out in the next couple of weeks. The other school districts we're partnering with, Shaker in North Colony, were great. Glad to get them vaccines. Thank you to Dr. Whalen and her team, my team, and to all the superintendents. I know Albany is going to be doing a lot through Whitney Young. I don't know if I think it's next week, right? Through Whitney Young at Albany High School, I believe. They'll be doing more vaccines. And again, the sooner we get kids vaccinated, the sooner we get back to some type of normalcy. Dr. Whalen.
Thank you, County Executive. And I will say I think that clinic at Albany High School is on April 22nd, if parents are interested. So this was a busy week, and in particular, we had a lot of questions at the health department, understandably, about the J&J vaccine. So, what we know about this nationally is that there have been in excess of 6 million doses, and we have 6 individuals reported that have had severe side effects related to cerebrovascular blood clots. So this is a concern, but it is an incredibly low risk. And I believe that the pause will give opportunity to look at this in a more systematic fashion and give us better information on whether this vaccine is appropriate to be reintroduced, and if so, are there certain populations that should and shouldn't get it. So we will continue to follow that. I think it's important for people to note that the Johnson & Johnson vaccine formulation is a different type of formulation than the Pfizer and Moderna. So Pfizer and Moderna vaccines are mRNA technology vaccines, whereas the J&J is adenovirus derived. So they are made in a very different fashion, and I think this is particularly important to parents that may be looking at vaccinating their 16 or 17-year-olds. We have not seen any incidents of similar side effects or complaints with the Pfizer or Moderna at this time. And, as the months and time goes on, we have more reassurance that these vaccines are safe, and we know that they are effective. I will again state, I stated last week when the eligibility criteria was going to be opened up, and I will state now, my 16-year-old has had the Pfizer vaccine, and I am comfortable as a mother having her vaccinated with that vaccination. This week at our pod, our Wednesday pod was the first time that we were able to vaccinate 16 and 17-year-olds, and I was very happy to see many, many young people coming in with their parents being vaccinated. And I know in particular, again, looking at it from the perspective of my own daughter's experience, it's been a tough year with being on quarantine when kids have been exposed and knowing that they have to spend that time on quarantine to be away from friends, away from school, away from their normal activities. Once a child is fully vaccinated, and again, that's 2 weeks after their last vaccine, quarantine is not recommended. So I think that a lot of kids are really happy about this this opportunity not to have to miss out on things, particularly kids that are involved in sports, extracurriculars, and everybody that likes to be, and I think that goes for pretty much all 16-year-olds that like to be around their peers. We do still mandate masks, and that will be mandated until such time as we get to a much higher rate of vaccine and a much lower rate of disease. As the county executive indicated, we are now getting to the point where we are really having to look at how we can broaden the amount of people that we're vaccinating. To date, when we have posted a vaccine clinic, it has been filled up within about 5 minutes. This week was the first week that didn't happen. I think that was probably in a large part due to what happened with the J&J vaccine. But we also knew that that day was coming as we vaccinated more and more residents who were ready to be vaccinated. So what are we going to do to get us to the point where we can really start to get back to normal? And I think that there are a lot of steps, and I agree with the county executive's thought that he just put forward. We need more physicians that are doing vaccinations in their offices. Physicians can sign up to be New York State certified COVID vaccinators. It is fairly simple paperwork that is available currently on the health provider network of the New York State Department of Health, but hopefully we're going to be able to post that and get that into the hands of those that need it. We know that people feel more comfortable. It's important to vaccinate people where they're comfortable, and not everybody is comfortable going to our pods. So having that at providers' offices and enlisting additional partners from the community, as we have done with pharmacies, with first responders, with people that can get into homes and into churches and into community settings where people feel comfortable. This is an important strategy. We also need to continue to work to combat the abundance of misinformation that is available, particularly on social media. I know we've cautioned here against getting information from secondhand stories on social media, and really trying to look at where you can get trusted evidence that is based on looking at this at a much larger perspective. We are also starting to look at data. Where do we know that there are pockets in our community of people that have not been vaccinated? And can we help target educational efforts? In particular, we have worked with community health workers through many of our public health programs who are individuals that represent the communities that they serve. So having those trusted messengers within the communities to be able to speak to people that are hesitant or reticent to get vaccine, to explain to them what brought them to a level of confidence to get vaccinated themselves, to utilize ambassadors like that, health ambassadors, is going to become very important. And also eliminating barriers to access. So even though not everybody is comfortable being vaccinated in a pod, a lot of people have represented to us that one of the barriers in being vaccinated in the pod is the online sign-up. So I'm happy to say this past Wednesday we were able to accommodate 100 walk-ins, and we will be looking to do that in the future with our clinics, and we'll announce that as the clinics come. Hopefully the ability for people to be able to walk up, and people that were able to walk up were really grateful that they didn't have to worry about how am I going to sign up, what do I have to go through, what do I have to put down. You need your ID and you need to show up. So as we can break down these barriers, we hope that we can and we are enabled to vaccinate more people. But this is going to take a lot of work. It's going to take a lot of partnerships. And I'm again happy to say that in Albany County we have no shortage of willing partners that are very interested in working on this. So we will continue to work towards getting this out, because unfortunately we are still seeing people suffer with COVID. We are still seeing younger people suffer with COVID. We are seeing hospitalizations and we are seeing deaths. So COVID is not finished with us. And the best way for all of us to move through this and ultimately get past it is to be vaccinated, and in the interim to continue the important public health mitigation efforts that we have advocated for every day for over a year now, of wearing your mask, social distancing, frequent hand washing.
Thank you, Dr. Whelan, as always, in your incredible leadership through these difficult 400 days and counting. But today is also a very important day to us here in Albany County, and actually should be a very important day to everyone in the state of New York. We're celebrating the career and retirement of a truly incredible public servant. Bill A. has served as director of New York State Office of Indigent Legal Services for the last 10 years. He's done more in this role than most people do in their lifetime. But Bill has an impressive career. Before he joined ILS, he graduated Harvard Law School in 1974. He continued to work in Massachusetts on the Defense Committee. Bill eventually made his way to become second chief counsel for the Public Defender Division of Massachusetts Committee to Public Counsel. So needless to say, Bill was the perfect candidate to take on the leadership role at the New York State Office of Indigent Legal Services. And I was proud to work with him during my time advocating the state to cover the cost of public defenders for the counties, because we know in this state for far too long there's been two tiers of justice, one for the rich and the one for the poor, and the scale couldn't have been better, because the scale's been up here for the rich and for the poor has been down here. So, but in 2017, with a lot of partners, legislation, we wrote in my office, and we got Assemblywoman Pat Fahey to jump on board. The legislature and state committed to providing $250 million to counties over a 5-year for public defenders. That's more than $26.2 million of that has been committed to Albany County since then. And Bill A. has been a huge part in that advocacy, hard work, in trying to rate the system. I'm glad that Mass has let us borrow you for 10 years. I think it's selfish of your wife to want you back now and making you retire, but we could use you for another 10 years, Bill, but I get it. You want to go back. You haven't fallen in love with New York State yet?
Oh, I have fallen in love with New York State. I'll speak to that.
Okay, all right. I just want to make sure. But the funding puts the salaries of our attorneys in line with those with the district attorney, assistant district attorneys, and a lot of resources that these departments in our public and alternate public defender's office have not had the tools and resources to adequately try to defend on a level that people deserve. And they've worked hard. Our attorneys have worked hard. Our leadership in these departments are second to none. I can't thank them enough, the two of them. And this just gives them the tools in the arsenal to be competitive, to defend somebody. And I got to tell you, you can argue about bail reform, you can argue about a lot of things. What people don't realize, when people didn't have money, they pleaded to things they shouldn't have because they didn't have the money to defend themselves. So instead of saying, all right, I'm not going to go to court and fight this little misdemeanor because I can't spend $200, and that's just one hash mark, and then something else happens, and the next thing they know, they're going to jail for 4 years, and they're like, well, why? And they didn't realize all the other stuff they pled to led to that outcome at the end. To Bill and his leadership, and to everyone across the state, thank you. Bill, it has been an honor working with you. Your inspiration, your fortitude, and everything going forward, I can't thank you for enough. And if you always look at, the cohesiveness of this whole organization, you changed it, Bill. You changed it by staying the course and getting it done. Please, Bill, would you like to say a few words?
Thank you, Dan. And I think I'd like to pick up with something you said in your opening remarks this morning, and that is, with a partnership, you can accomplish almost anything. And so this isn't about one person. What we did in Massachusetts wasn't about one person. What it is about making partnerships, developing leadership. So I came in from Massachusetts. I had heard a lot about New York. I had read a lot about New York. Way back in the day, before I went to law school, I taught school in the Bronx for 3 years, right out of college. And so I knew a little bit about New York, but the pertinent fact is that I was coming into a state which had delegated to the counties, right after the famous Gideon decision in 1963, the state legislature and the then governor passed the so-called County Law 18B, and which put the whole burden of providing criminal defense representation and defense of parents in family court upon the counties. And they did it with no money. They just said, this is a county responsibility. So when I came here, there was already a lawsuit pending that had been filed in 2007. I came in February 2011. And I had a board, and I want to mention that board because it is chaired, it's a 9-member board. It is chaired by whoever is the chief judge of the state at the time. So Jonathan Lippman for my first 5 years, Janet DeFiore for my second 5, who have provided total support. I know sometimes people think judges might tilt towards prosecution or might not care about public defense. These two individuals have cared and they have showed their support and for everything we have done. The second thing is the role of Albany County leadership. At the time our office, the statute was actually enacted in 2010. Mike Breslin was then Albany County executive. Mike turned out to be one of the 2 board members of our 9-member board who are recommended by the State Association of Counties. So Mike Breslin from Albany and Joe Mariana, who's the retired county administrator from Tompkins County, were and are still today stalwart board members and tremendous supporters. And then Dan is elected. I didn't know Dan didn't know me, and we started working together. I have to credit Judge Larry Rosen for his critical role in getting us together. Phil Calderon when he was deputy. I know Dan Lynch is now, but Phil played a terrific role. And it's all about partnership, and the other really important thing, leadership. And we've got 4 leaders in the room today that I want you to know about. Judge, I don't know if we can still call you Judge. Judge Herrick was judge for years and years and years, but now he's the public defender, and I got to tell you, he has jumped in and led that office, and it's one thing to have the $26 million, that's nice. You can squander that or you can invest that. Albany County is investing that money in good decision making and building a good level of representation that poor people deserve and they're entitled to under the Constitution. Steve Herrick, I have to tip my cap to you for the way you have switched roles and taken over that leadership responsibility and run with it. Evelyn Kana is the head of this is even bigger because in geographical sense. Yes. What is it, 26 counties? Or it's the whole of northeastern New York regional immigration assistance centers. We have created 6 of them throughout New York State. And the idea there is that the Supreme Court in 2010 in the famous Padilla versus Kentucky case, not as famous as Gideon, but it's a famous case, and it says that defense lawyers, public defenders and other defense lawyers have a constitutional obligation to advise their clients about the immigration consequences of a conviction. So Dan was talking about people who take a plea because they're kind of worn down by the system. Well, some of them, as he said, are innocent, but they plead guilty anyway. Some of them might be guilty, but they might say, oh, probation, pretty good deal, not realizing that this is going to put them on a deportation train. So Evelyn and Bakary, who works with her, who's here also in the back, are doing a fantastic job leading not just Albany County, but this whole giant geographical region, and it's been a great pleasure to work with them. And then we have Tina Sodi over here from the new alternate defender. I always call it conflict defender. It's the shorthand. Alternate defender office in Albany. And she follows in a long line of effective leaders in that office. She's doing a great job. We've known Tina since our early days, Dan, and we're thrilled with your appointment of her. And Tom Boncourt, I may mess up the last name, Tom. We've met each other recently. I think is working with Larry Rosen and as the assigned council administrator and in charge of building up that part, because one of the things we believe is the quality of the representation you get wherever you are should not depend on whether you are represented by the public defender office, which in some locations has much more resources, has a staff. So Tom is leading an effort to build up the assigned counsel program in Albany County with 100% state funding to the level that it should be at, and the equivalent of the fine work that's done by Tina's office and Steve's office. So it's just been a great pleasure. I do love New York. I loved it when I was here as a young person. I was in the city then. I didn't know anything about upstate. I was probably one of those people who thought upstate was Newburgh or something, you know. But so it's been a tremendous pleasure. I've been all over the state. It's been a tremendous pleasure working with Albany County, and you know, our aim is to make Albany County the center of eastern upstate New York, the powerhouse, the resource for programs in counties that have you know, fewer numbers, fewer population, maybe less farther along on the curve to greatness. I think that's the dream of all of us who are working on this. And again, to come back to the partnership, you cannot do this without the partnership. And you have to shed your, you know, your county parochialism and your state arrogance, right?
Yeah.
And we've been able to do that, and I'm very, very proud. And I'm very grateful to you, Dan. You were the first county executive to call me when I announced my retirement a couple of months ago to say thanks. And you're the only one so far who has invited me to a public press conference to speak my piece. I really appreciate it.
Well, I appreciate what you did, changing the outcome for many lives, and a lot of lives you'll never know about, and we'll have a different outcome in today's society. And you're right. Thank you to everyone. I forgot about Phil Calderon because he left me for the airport. Now you're leaving me for Boston, you know, and there's a theme here.
Dr. Whalen's still with you.
Dr. Whalen's still here, right? Dr. Whalen's still here? Okay. So, you know, I appreciate that. And Judge Rosen and everyone else is for their leadership, because it has been a partnership to get it done. And I do have to say nice things about Assemblywoman Pat Fahey. Thank you, Pat, for carrying this and having the vision to get this through. But we do have a proclamation for you, you know, to say thank you for everything you did. So I do want to say thank you. I know you're still going to be around, so we're not going to miss you, because you'll still be helping us out and doing things, Bill. So thank you.
I certainly hope to be. Thank you.
Well, I hope you're going to be too, because you have changed a lot of things. Again, I do want to encourage everyone, please go to our website, do the pre-registration. You can see where testing's at and so forth. You heard me say it 1,000 times now. Please go to our website and sign up. Please do the pre-registration and go out and get tested for COVID-19 if you feel you have it. Our mental health support is available 7 days a week, as always, from 8 a.m. to 5 p.m., 518-269-6634. And we may be changing the hours because not that many people have been calling again, so I got to circle back with Dr. G and see what's going on, but that's good. It means people are adapting to the new environment they're in, and they're moving forward, which is all good stuff. 24-hour sexual assault hotline, as always. The number is 518-447-7716. Before I get to questions, I do want to talk a little bit about ODTA, which is the Office of Temporary and Disability Assistance. One of the questions we have received time and time again was what happened to the $9 million we got for landlords and for renters and to pay utilities. So on January 15th, I just want to give people a little bit of the timeline. On January 15th, or excuse me, as it was, January 5th, 2021, the Treasury launched $25 billion emergency rental assistance program. January 12th, 2021, Albany County Department of Social Services submitted an application to the Treasury Department. January 22nd, we received over $9 million in cash, well, not cash, but wired to Albany County. The state of New York was allocated over $800 million on January 22nd. So we've had at least no less than 7 to 9 conversations of how we can get this money out, because it had to be tied in to how the assistance can get out, what protocols we're going to put in place, and so forth. And it was mind-boggling to me. It took to April to get this letter. So April 13th, I get this letter from the Office of Temporary and Disability Assistance, explaining to me now how I can get this rental assistance out there. But what I find ironic with this letter, and and we talked to Monroe County, is now the state's telling me that I have to turn over the $9 million to ODDA or OTDA by April the 27th, or the residents or the landlords or the renters in Albany County are not entitled to the rest of the money. And it took them 3 months to figure out how to take the money that the Treasury Department gave us, and this is the norm of government, but the letter's up on the screen, and it was kind of disturbing because, again, they put a system in place for how you're going to register, how people are going to go online to get this assistance. And again, it's been 3 months for them to figure it out. And let's face it, and I'm not pointing fingers, but we need partnerships. I don't need to be dictated to of how to get $9 million out. We just needed guidance. And now I have to make a conscious decision, and I got to circle back with the chair of the legislature, Andrew Joyce, and Dennis Feeney, the majority leader. And I have to circle back with Frank Marinell, the minority leader, and decide whether or not if we're going to comply. But I can assure the residents of Albany County that there's going to be more than $9 million needed in this assistance. So what choice do I really have? But I will say this: what new website has the state launched in the last 400 days that has worked properly? So I just find it ironic that I did talk to Mike Heim a couple months ago when he mentioned this to me, and I made my opinions known then, and not until the 13th that we get a letter telling us that I have to the 27th to wire the money back, not sign the agreement and give the money back to the state of New York so they can decide how it goes out. And they did decide that they would give me a 10% fee if we helped with assistance with administration, outreach, and other things which we've been doing, which gets me to Monroe County. A lot of counties got the CARE Act money. And with the CARE Act went to the bigger counties with a certain population over, I think it was over 400,000. So a lot of them already have established this program. Monroe County has invested a lot of money. I feel bad for Adam Bello out there. They partnered with 13 different agencies to get this money out, and now they have to throw it all to the side and decide, do I give it to the $39 million to the state, or do I continue to go forward? And I find it ironic because they're saying fraud, that they don't want us running the program because I guess the counties aren't equipped and smart enough to run a program like this. But I just wanted to put it out there because I've gotten a lot of emails. I've gotten a lot of questions why that $9 million has never gone out. This is the reason. Now, only God knows how long it's going to take once, I have to make that decision to turn the money over to the state, and then 27th of April, how quick it's going to be up and running. So, again, once I have them conversations, I'll decide what direction the county is going into. But I wanted people to understand why that $9 million has not gone out. It's like everything else. Something gets passed in the state, we have to wait for guidance. And I couldn't hand out the money even though it came through the Treasury. We had to wait for the state to set the guidance. Well, they figured it out. They figured out how they're going to take our $9 million, everyone else's money, and lump it into all their $800 million and put it out there. But again, please, people, continue to do the right thing. Please wear your mask, cough into your arm, clean your hands, stay 6 feet apart, and stay safe out there.